While it might seem like you've spent much of your adult life avoiding getting knocked up, once you're ready for a baby, most women want it to happen, like yesterday. We checked in with a midwife and a reproductive endocrinologist to learn about the best ways to get pregnant as soon as possible. Make a schedule with preconception counseling. It's not like you're clueless as to how babies are made, but if you and your partner are ready to start a family, checking in with your healthcare provider before you start trying can be a very smart move. During that visit, you'll get a chance to review your medical history and discuss any possible issues that might come up during pregnancy due to past or current medical conditions. You should also come prepared with a list of all current medications, in case any might have a negative impact on your fertility or a pregnancy. Healthcare provider usually do a complete gynecological exam, blood tests, tests for sexually transmitted diseases, tests for rubella immunity, if you're not immune, get vaccinated, and use a reliable form of birth control for the following 3 months before getting pregnant, and possibly some genetic tests, based on your family history. Sometimes also suggests that her patients see a dentist as well, to make sure their oral health is good as well, given that late miscarriage. Get ready when you ovulate. You might remember from biology in high school that an egg can only survive for 12 to 24 hours after ovulation, while sperm can survive for 48 to 72 hours after sex. Unfortunately, this means that there's a pretty narrow window of opportunity for baby making. In order to increase the chances of timing things properly, it's helpful to know when you ovulate. While you might have a vague notion that ovulation typically happens around day 14 of your menstrual cycle, counting the first day of your period as day 1, that is probably the case only for women with a regular 28-day cycle, which is a minority of us. Most women fall somewhere in the 24 to 35-day range. What's true on a broader scale is that ovulation usually occurs about 14 days before the last day of a woman's menstrual cycle, or the day before she gets her period. So, for a woman with a 24-day cycle, ovulation likely happens around day 10, while a woman with a 35-day cycle would likely ovulate around day 21. If you're not sure how long your menstrual cycle is naturally, or when you ovulate, it may be helpful to keep track on a calendar of when you get your period and how long it lasts, to give you a better sense of when you're most likely ovulating. If you're feeling slightly more high-tech, a fertility calculator can be a handy tool when time is of the essence. Have sex before ovulation. To ensure that your partner's swimmers are meeting up with your egg at just the right time, try to have sex every other day, starting 5 days before you expect to ovulate. This 6-day period is sometimes referred to as the fertile window, ending on the day of ovulation. If you're using NOPK and you get a positive result that day, around day 12 in a typical 28-day cycle, where ovulation would take place on day 14, have sex that day and the next 2 days, if possible. While there is some evidence that having sex daily may lead to slightly higher pregnancy rates, every other day should suffice, and daily sex should be avoided if it's just adding to the stress of trying to conceive for you or your partner. If you're up for it, sex every day won't do you or your partner any harm. There's no evidence that frequent ejaculations decrease male fertility, according to the American Society of Reproductive Medicine, ASRM. Avoid using lube. This is a great excuse to encourage your partner to really amp up the foreplay. Lubricants can be toxic to sperm and may reduce your chances of getting pregnant. And while there are some lubricant formulas that claim to be fertility friendly, you can also just go for more kissing, touching, and whatever else you need from your partner to get in the mood. And who knows, maybe he'll even learn a thing or two. But should you need an additional form of lubrication, the ASRM recommends mineral oil, canola oil, or hydroxyethyl cellulose-based lubricant like Pre-Seed, if foreplay alone doesn't do the trick. Quit smoking and also avoid alcohol. Yes, there are dozens of valid reasons to quit smoking, but if you, or your partner, haven't kicked the habit yet, add one more reason to the list. You could negatively impact your fertility, as well as that of any potential kiddos. Yep, smoking may actually harm your child's fertility too. If your fella needs more convincing, let him know that smoking may lower sperm count and motility, as well as lead to increased abnormalities in sperm shape and function. Additionally, smoking has been associated with an increased risk of miscarriage, premature and low birth weight babies, and an increased incidence of sudden infant death syndrome, SIDS. Then about alcohol, some doctors recommend that you completely avoid alcohol when you're expecting. Others say that occasional light drinking is unlikely to harm your baby. Carol Archie, MD, Associate Clinical Professor of Obstetrics and Gynecology at the David Geffen School of Medicine at UCLA, is concerned that even small amounts of alcohol can affect a developing baby's brain. We know that alcohol impacts brain cells and that the baby's brain is constantly developing throughout the entire pregnancy, she says. So I would say to a pregnant mother that it's probably best to abstain from all alcohol. Keep consuming healthy food. Here are the 5 food categories you should make an effort to consume more, so you'll do your body good in the months to come. 1. Folic acid. 2. Beans. 3. High-quality protein like salmon. 4. Fruits and veggies. Don't force, enjoy, and always be graceful. Felicia Stewart, the title MD, said that the most important thing to remember is to keep sex fun. Do not think too hard to get a baby soon, and not too demanding on the pair. Relax and enjoy togetherness when having sex.